Hello, I'm Dr. Tina Atkinson. Just want to say thank you to Elliot Desnoyers, who asked me to participate in this speaker series, and Dr. Cheryl McDonald for this important initiative. Just to tell you a little bit about myself, I'm a sport medicine physician in Dartmouth, Nova Scotia. I've been practicing full-time sport medicine since 2006. Before that, I've actually practiced medicine. This is my 25th year. But initially, in the beginning of my career, I did family medicine, part-time emergency medicine, and volunteered for a lot of sport medicine events, as that was my actual goal, was to eventually be a full-time sport medicine physician. In 2011, I helped organize the Canada Winter Games, the medical component of the Canada Winter Games here in Halifax. And after that, I was asked by the Mooseheads athletic trainer at the time, to join the Mooseheads as a primary care team physician. They had other specialists, orthopedic surgeons, emergency docs who worked with the team and covered the games, but they had never had a primary care physician, which means that I take care of all of their needs, sport injuries, as well as regular family medicine type of concerns. So I've been with the Mooseheads since then, since halfway through that 2011 series. Very fortunate to win a Memorial Cup in 2013 and help and organize the Memorial Cup here in Halifax in 2019. As well, I mentioned I've volunteered for a lot of different events that have been held in Halifax since 2004. Probably my first one was the World Women's Hockey Championship. And I also, along the way, have 3 sons who are now young adults, and they all played sports. So they all played AAA and travel hockey. They play rugby, they play baseball. So I was a very involved sport mom as well along the way. Currently, in the last couple of years, my role what I do for work has actually changed. I've worked with Hockey Canada since 2016, but I was asked to be part of the quad leading up to the Olympics for the national women's team. So we began that journey in 2018, and I was fortunate enough to go to the Olympics, which I just came back from a couple of weeks ago. So I'm the national women's team physician for Hockey Canada. I still work with the Mooseheads, although I haven't been around as much this past season. I also was offered a position as the first chief medical officer of the Sports Centre Atlantic, which is part of the Sport Institute across the country, funded by Own the Podium and other funding to help support the Olympic and Paralympic athletes, as well as all national sport organizations and provincial sport organizations. So I have a part-time position there. I've worked with them since 2012, but now I'm officially their chief medical officer. So that's been really interesting, really exciting. Lots of new things in the future coming up. So I'm excited to see where that's going to go. As far as what this leadership or what this speaker series is about, are challenges as a female in sport. I think that I have been fortunate as a physician. I probably don't encounter as many obstacles or challenges as other females do trying to become a leader or trying to have a full-time position in sport. As a physician, I certainly, like I said, I graduated from my residency program 25 years ago. So things were, different then, and there were a lot of, at that time, I think about 50% of my family medicine residency were female, which has traditionally become even more so female. So that wasn't unusual, but we still encountered some difficulty in the hospital at times where people would think that you were the nurse, or, there were a lot of male nurses who were assumed to be the doctor. I mean, that was just the way things were, and I think still are to a certain extent. And, I found that over the years, as long as you were good at your job, that people very quickly adapted. I don't know if I've had anyone who refused to see me because I was female or refused to have me take care of them. As far as working in sport, as you probably know, amateur sport in Canada and even semi-professional sport, such as the Mooseheads, a lot of the medical coverage is volunteer. So it's just the way it is in Canada. In the States, not so much. It's actually the opposite in a lot of cases. Clinics and doctors will pay the team or the organization to work with them in exchange for having their athletes come to their clinic and then being able to advertise. It's not that way in Canada just now, but it is changing, and I think it's going a little bit more in that direction. Unfortunately, though, we don't get paid in the same way as in the U.S. because it's publicly funded, and that's the system I prefer to work in. If you are a professional sport med doctor working with professional teams such as the Blue Jays, the NHL, the Raptors, then you would certainly be paid in a different way. However, the one downside or I guess challenge with that is our regular malpractice insurance doesn't cover us to work with professional athletes. So you do have to go ahead and get your own extra insurance to be able to work with those professional teams. So for me, I've really had mostly a good experience, especially with the Mooseheads. There was never any question because I was a female that I wouldn't be able to do the job. I have found over the years that sometimes players were a little bit, I don't know if the word's suspicious, or they weren't sure that I knew much about hockey, or I would understand what they were going through, or I would understand what their injury was. But as soon as I worked with them, I don't remember anybody who I found difficult to work with or to treat or to manage. They all have been very grateful and polite and easy to get along with. So I really don't feel that that's ever been an issue. It's interesting because I've only ever had female athletic trainers working with the Mooseheads. So I'm on my third one now since I've been there. And they may have a different experience than I do since they're with the team 24/7 almost, of day in and day out, and then certainly traveling. I do travel with the Mooseheads in playoffs. And again, have never had any issue. It is a challenge sometimes when you go to other rinks and it's an all-male staff. I do find it's a little bit of a different vibe, but I as I said, I believe that if you are excellent at your job, then that shines through, and there may be some sort of difference of opinion or opposition or assumption that maybe you aren't going to be as good as a man in a hockey world, for instance, but I do think that's changing, and I've really never felt that, to be honest. The longer I've been around, obviously I've been around a long time now, people come to me for advice now and for help and collaboration. So, I feel that stigma or that obstacle at this point in my career is definitely gone as far as dealing with hockey in Nova Scotia, and hockey players, and sort of the culture of hockey. That being said, I think that if I wasn't a physician, maybe things would be different. One thing that I did think about reflecting on what I was going to say for this series is when my kids are playing hockey, I did actually encounter more of that assumption that I didn't know anything about hockey or I didn't know anything about sport. And that it was automatically like, oh, well, the hockey moms don't know what they're talking about. And, I didn't play hockey when I was a kid, and my brothers didn't play hockey. We were a basketball family, I would say more so, but I really played every sport in high school and went on to play club rugby at university because it wasn't a sanctioned full varsity sport yet. Played rugby for the provincial team, so that was always a part of my life. So I didn't understand that attitude that I wouldn't know anything about sport, instead of the automatic assumption anyway. So I guess that is one challenge that I would say females probably still have in sport until you until you sort of tell them your background or they get to know you. And I would say maybe more so in hockey, they're going to assume that you don't know what you're talking about, or you shouldn't have any kind of opinion. So that's one challenge I can see for anyone who wants to make has a passion for sport, and for hockey in particular. I can speak to that it would be a challenge when you first get into it. I would hope that in 2022, especially if it was a woman who had played hockey, that wouldn't be an obstacle. But that's something to think about. And the other challenge or other frustration that I have is that I do find it frustrating to explain to people why it's important to have a diverse, important to have people from different backgrounds working in sport, whether that's male versus female or people of color, or any other diversity, a diverse background. I think it's important. It can only enhance your team. It can only enhance your culture. So for me, as far as explaining, for instance, why female sport is important and why there should be professional leagues, when people ask me questions about that, or I sit down to think about it or to talk to them about it and try to explain it, I get really frustrated and so it does become mentally draining to have to explain to someone why that's important. I feel that that's part of, it is something that I sort of feel like I should do, and I should be responsible for, to try to promote female sport. But I do find it exhausting to have to explain to people why females should have professional leagues and why that's important. To continue that thought, similar to what I said before, I believe that female sport, for anyone that is working in sport, whatever your role is, it's really crucial to be excellent at what you do and have a passion for it and put the work in. And then those obstacles can be more easily overcome as far as any challenges with getting hired or just getting experience so that you can move up in your position, whatever that is. I do think it's important for females to encourage other females, which hasn't traditionally always been the case. I'd say, 20 years ago, 25 years ago, there was sort of I don't know if it was a competition type of thing, but I did encounter sometimes, especially in the physician world, that certain physicians may have had obstacles and may have been forced to do certain things, such as work a certain number of hours or only could work in certain clinics, and were told they had to work a certain number of hours by the management. And so when I wanted to work in a different sort of way, be more flexible, part-time, or work more hours one day and less hours another day, it was told that wasn't possible because basically they didn't get a chance to do that. They weren't able to do that. So there was a little bit of, you keep that other person down or put obstacles in their way because you weren't given the same opportunities. And I don't believe in that. I think that that's not the way to go. We need to encourage each other, and things evolve, things change, and I believe that we should support each other even if their choices are different than ours. I do think that it's very important for young people to start seeing women in leadership positions in sport, again, and no matter what your occupation is within that sport, because then it becomes normalized and it's not so abnormal, it's not unusual, it's very normal to have a woman doing a job that traditionally a man would have done. And I think that takes time, but it is happening, and it's really important for us to encourage and have opportunities for women to apply for those types of positions and get those jobs and then be excellent at what they do. And that will help. I would recommend that anyone, if you have a passion for sport and you want to work in sport, and when I say work, I include volunteer work. because, like I said, volunteerism in amateur sport in Canada is the backbone of amateur sport, and improving opportunities for young girls and boys to play sport and continue playing sport. I include recreational sport in that as well. Very important for us to keep our young people active and keep people active as they get older. Our healthcare system is going to suffer unless we can sort of change. It is suffering already, but it's going to get worse unless we can change a lot of lifestyles that people choose, which are not healthy and will put more of a burden on the healthcare system. So improving access for boys and girls, men and women, to recreational and higher level sport when they're young and as they get older is really important. And I feel that that's another reason why it's important to have more women working in sport, and whether that's as a volunteer organizing sporting events or recreational events, or it's working in professional sport. We need to keep young girls in the sort of preteen, teenage years. We need to keep them active. They still drop out of sport at a much higher rate than boys of the same age, and that has impact down the road on maintaining healthy lifestyle and just their social and mental well-being. So that's an important, we need to, I'm sure you've all heard this before, you need to see it to be it. And the more women we have on TV playing sports, the more women we have of all different backgrounds, all different body types, for instance, the better to keep those young and adolescent girls in sport and at least being active. I do feel that there's been lots of progress in this avenue with like the Doctors Nova Scotia Fun Run, for instance, in school, as well as other like the Blue Nose Marathon and just a lot of more time spent on promoting healthy, active lifestyles with exercise. There is a program in the UK where kids run a mile a day, and they walk or run a mile every day before they start school. And it's shown to improve their attention, improve their test scores, and just improve their overall, like how happy they feel, and help them start those good lifestyle habits when they're young. So for me, that's very important. My specialty is actually called sport and exercise medicine, and some of that and the exercise medicine piece is just encouraging everyone to exercise and stay active. I feel that the more women who continue in sport, that will have an influence on their children, and that's just only going to be a positive thing going forward. Also, it's important for women to have more voice in government to do with sport and or recreation, so that it's all types of activities are included, types of activities that traditionally men would want to do and women would want to do, to have access to pools, hiking trails, arenas, all of those recreational facilities which are very important to a community. And then in that way, I think women traditionally being more in charge or sort of influencing the family and organizing things for the family, I should say, then that will help to keep kids active, which is really important for our culture and our society in moving forward. So those are basically the challenges that and things that are important to me. To summarize, one of the challenges that I spoke about was, as a female, I felt that often men assumed that I didn't know anything about sport, or I wasn't interested in sports. I don't watch sports, which is actually untrue. My family was a big, there was always sports on the TV, whether it was track and field, tennis, hockey, baseball, basketball. The Olympics were huge in my home when I was growing up, which we watched faithfully, anytime that it was an Olympic year and the Olympics were on. It was a dream of mine to go to the Olympics since I was a little kid, actually, and in high school I realized I'm not going to go as an athlete, so I had always, since about grade 11, my plan was to go to med school and then eventually be a sport medicine physician, which it took me a long time to get there, but I wouldn't change any of it. But I was lucky and fortunate enough to be able to go to the Beijing Olympics and fulfill that dream. So that was amazing. So my advice there is never give up. If you do know what you want to do in the future, you have an idea, you have a dream, and it's in sport, in any way that touches sport recreation. I wouldn't let being female stop you. I think that the opportunities are there. I hope there will be more and more of them in the future. Even something like this, as an educator, Dr. McDonald's, decided to do this to help, and I think people can do it in their individual ways in their own occupations. The next challenge that I didn't really talk about, but it is still an assumption, I would say this is something that needs to change, excuse me, would be that women who are whether you're on the medical team, whether you're a coach, whether you're an administrator, that you should only work in women's sports. I know recently we've seen lots of professional teams and semi-pro teams and amateur sport hiring women to be coaches or leaders, advisors, administrators.